When too much toxic material accumulates, enough to damage the bronchi, you will get chest inflammation or bronchitis, not due to a virus or a cold. See, so there's the antibiotic fallacy. Not due to a virus or a cold, although your sputum will show viral or bacterial presence. Actually, they were there before the attack.
Yep.
It is really just due to the level of toxicity in the bronchi that has built up a little too high and needs to detoxify.
Hey, everybody, it's Dr. Jack.
And Mary.
And welcome back to the Forbidden Doctor podcast. This is podcast episode 153, Asthma and Bronchitis, Heartless Killers.
Yeah, today we're going to talk about some forbidden healing modalities concerning the current understanding of asthma and how it's become the drug-dependent condition of which medicine says there is no cure.
Yeah.
And it's a sudden killer of so many children when just 70 years ago, almost no child died of this condition. And did you know that in the UK, one in seven if children that enter a hospital in the UK, 1 in 7 for asthma, that's what I was trying to say, for asthma, dies.
1 in 7
dies. They enter with an asthma attack and they die. They don't come out.
Not good odds.
No. So we're also going to talk about bronchitis that often occurs with chronic asthma and can be deadly, as you'll hear in just a few minutes.
Yeah. So, but before we get to that, for our regular listeners, the next 4 minutes is our financial stuff, and you can fast forward through it if you choose. But for our new listeners, please listen at least one time so you understand how we do things around here. We want to take a few minutes to talk about why we do not have sponsors.
Yeah, we've been approached many times to sell different products on our show.
But we've always been compelled to resist these financially tempting offers because the work we're doing here is just too important to be beholden to some brand names who could object or even try to gain editorial control over some of the forbidden things that we say.
Yeah, so we would never allow this kind of advertising on our show.
And others have mentioned that while the knowledge we share cannot be found anywhere else, it is often tied to products such as the whole food supplements from the oldest nutritional company in America, Standard Process, which we often reference during our shows.
And this also would include our own ageless thyroid and long life energy enzymes.
Yeah, and so you might ask, could not our own products be creating conflicts of interest? I mean, have we mistakenly created an infomercial instead of free knowledge podcasts?
No. We do this on purpose.
Yes, we do. Years of experience in our clinics. And almost 500,000 downloads of our podcasts have taught us a few things. And the most important is that the type of nutrient-dense foods most of us need to get our bodies actually healing from years of malnutrition are not easily integrated in most of our lives.
Yeah, the quest for excellence in nutrition has never been an easy endeavor.
Yeah, no one wants to eat raw liver. But absolutely no one is going to sign up to eat raw liver daily for 6 months if that's what it's going to take.
Well, some people will. A patient of ours found she was told she had only a few months to live and refusing that notion. She went home and threw some liver in a blender with a few spices and drank that every day for months.
Yes.
She lived very well for another 20 years.
Yeah, I met her more than 20 years ago when we were both doing a radio show at the same station.
But many people will not do that.
Well, no.
Yeah.
No, so let us be clear. We reference one-of-a-kind whole food supplements from the nutrition company Standard Process because this is a way to realistically nourish ourselves with the whole food and organ meats we would never eat on a daily basis.
And the reason we do our podcast this way is because it has saved our lives and countless others that we've worked with over the years.
So we sell supplements, and we try to give free knowledge away about how nutrition touches every aspect of our lives, and so necessarily these two overlap.
But we want to be very clear here. Some of you may feel real hardship with even a modest monthly donation and cannot afford even a single month's supply of supplements.
So please then, do not buy our supplements.
Or even try to financially support our show in any way if you cannot afford to. This free information will still be yours forever.
Yeah, of course.
And we want you to take it and use it with our blessing.
But if you like what we do at Forbidden Doctor, there are several ways you can still support us.
Yeah, you can leave a positive comments or reviews on our website underneath the podcasts, or on iTunes or YouTube, or like us on Facebook and follow us on Twitter or on Instagram. That type of support for us is free. It costs you nothing, and we would greatly appreciate it, and it would greatly help our mission.
Yeah. So if you're ready to take your first steps for your own health, take our free symptom survey and let our nutrition specialists develop a personalized protocol for you. And then try some of these one-of-a-kind whole food supplements for yourself.
Yeah, there's a link for this free survey on the very top red bar on every page of our website, forbiddendoctor.com.
Now, if you already support our show, thank you.
Yes.
And please know that you are the very reason we fight this good fight. Your support makes this all possible. Mm-hmm. So now, on with the things they don't want you to know.
Yes.
So let's get started with a tragic story to hit very close to our home.
Yeah, actually, it was close to our home. It was last Sunday in our own neighborhood. We have this neighborhood Facebook group that is just the houses where we live, and suddenly it just blew up with messages about what's going on with all the ambulances in the neighborhood, and the answer was just horrific.
It was tragic.
It was tragic. A little 4-year-old girl suddenly died.
Suddenly died. She came home from school on a Friday. This was last Friday. And, a week ago.
Yeah. And complained of a sore throat, not feeling well. And her mother took her into the hospital to the doctor Sunday. And the doctors diagnosed her, took her to the doctor after she developed a fever, cough, and started wheezing. Doctors started treating her for bronchitis, and she was placed on antibiotics and started using a nebulizer. They sent her home, where she quickly declined and collapsed later that day. I'm reading right from the article.
Right. There is no estimation of the tragedy that this is. I mean, we came within 24 hours of losing our son. Mm-hmm. And I can only imagine what they went through, because the mother was found by the EMS people when they showed up.
EMT. Trying
to give her CPR.
Yeah. Yeah, and she didn't even make it into the ambulance. She died. And what people don't understand is how deadly asthma is, and how deadly and how quickly it can turn into bronchitis, and the children are just gone.
Yeah. Now, we don't know for sure whether she had asthma or not, but she did have bronchitis, and we're really focusing on asthma here. At least she was diagnosed with bronchitis because she was wheezing.
Wheezing, which we'll talk about.
And that's because the bronchi were closing, the bronchi on each side, the bronchus on both sides that are the bronchi, were closing down, and that's why they gave her that inhaler,
which has a
probably
steroid
a
in it.
Corticosteroid, to force those airways back open, which in an inexperienced state would seem only the obvious thing to do.
Mm-hmm. Got to get air in. Well, eventually, those collapse. And on our VIP...
That's what we're going to talk about, why they collapsed.
And why you can't get them back open with trying anything. And on our VIP webinar call we did just last week, that we showed pictures, because it's a video cast, and so people could see. We showed a picture of this beautiful little girl, but the dark circles under her eyes just indicated gut dysbiosis.
Yes.
And
at least some level.
Yeah. So she had signs of a sick gut or something because of the black circles, and we don't know anything about her condition prior to death, except for in the news article. Oh, and then also on our Facebook group, they had all kinds of information, but nobody ever said, oh, she definitely has had asthma for years, but she was wheezing, and the news article said sore throat, fever, and wheezing that led to bronchitis, or at least that's what she had been treated prior to the inability to breathe a few hours later.
Right. And so because we take care of so many children in our clinic, and I see healthy children and I see sick children, and when I see children who are coming in who have dark circles under their eyes like this precious little princess did, I already have a good idea what their health history is like, or at least their dietary history. And as all disease begins in the gut, and she had physical signs of a gut problem, we want to mention some forbidden knowledge at this point.
Yeah, we want to try and save some little girls. So, understand this. A sick gut produces toxins.
Yes.
And some of these toxins are expelled as gases in the lungs. And these toxic gases damage the delicate bronchial branches.
Yeah, the bronchioles.
Yeah, as they're expelled out. And we have no way of knowing for sure, but our experience is that her gut may have been a causative issue.
Yeah,
here.
and we say may, whether damaged by toxic gases, some reaction to some dust or pet dander or some airborne allergen, the bronchi and the smaller branches, the bronchioles that are associated with her inability to breathe, really can be repaired very quickly by the body, provided there's enough good nutrition.
Yeah, and what are our children fed today?
Well, not good nutrition.
No, macaroni and
it's
cheese.
rare. Good.
Cheerios.
Of all the children that I see, and interestingly enough, it wasn't always this way, but it kind of is now, I usually see pretty healthy kids because it's people I've been taking care of for a while that are their parents, and they say, hey, we want our children under the same care we've been under because we know what's happened to us. And so we have no way of being sure
that she had a bad diet.
That she had a bad diet. And this constant battle of inflammation and repair is always going on. But in asthmatic children, usually it's the inflammation that's winning.
Yeah, and it's the chronic problem.
Yeah.
So here's what happens. The body is so brilliant. And like we said, nobody died of this before
the
1950s.
Yeah.
So the body will shut down either end of the bronchi to repair it if it's been, damaged by these toxic
gases or some allergen or whatever else.
And here's the thing. It only takes about 20 to 25 minutes to do this. Your body's not stupid. It doesn't shut down all the bronchial branches all at once. You couldn't breathe. So it shuts these down over here and shuts down both ends of the bronchioles, and then it gets in with inflammation. Ooh, that nasty, dirty word, inflammation, that is bringing healing blood to a part of the body that needs to heal. And when it's healed, then it opens it back up. And it doesn't shut them all down at once. It just shuts some down, and then 20 to 25 minutes later is all it takes to heal, and then it opens them back up.
Yeah, and so what you do, at least in the olden days, and I'm not saying you do this now, but we have read this in history, but they used to just wrap a warm blanket around the child, give them some bone broth or warm tea to drink, help to calm them down because obviously they're very anxiety-filled because they're having a hard time breathing. And in about 20 minutes, they were better.
Give it to the mother, too, because she's anxiety.
Oh, she's full of anxiety.
Yeah, so she needs the warm. But you just have to keep talking to them, calm them down. And it was a very benign thing that used to happen, this asthma now that is so deadly. So here's another example. If you see a big accident on the freeway, both ends of the freeway will be shut down. So the emergency vehicles can get in there and clean up the accident. Yeah. But if there's 70-mile-an-hour cars going through the scene of an accident, eventually the freeway would just shut down. It would collapse.
Yeah. And so inhalers or nebulizers, such as the one this doctor prescribed, chemically force the bronchial branches to open up. And you think the doctor is a hero because suddenly your child can breathe, but at a huge cost.
Yeah, this is akin to, like I said, the 70-mile-an-hour cars going through the scene of an accident, and eventually the bronchi just collapses, and nothing will open them up. Yeah. No amount of inhaler, steroid, no medicine no CPR, which the mother was doing on her, and of course, when they all collapse at the same time, you suffocate to death.
Yeah.
Now, I can't think of anything more horrible than watching your child suffocate to death.
Yes.
Yeah. This forbidden information is not explained to parents.
No. The doctor prescribed antibiotics and the inhaler. And the antibiotics further damaged an already damaged and toxic gut.
Further.
And the inhaler kind of just sealed the fate. I mean, the steroids in those inhalers stop all inflammation, which in some crisis situations, that's what we want, but it stops the healing as well. I mean, how else do we heal but by inflammation?
Yeah. It's kind of like taking Tums for heartburn.
Yeah.
It works. It neutralizes the acid, but at what cost? Not breaking down your proteins for one thing.
Yeah.
That's the cost. So you don't heal and rebuild. This child was killed by modern crisis care medicine. Not intentionally,
No,
of
not
course.
intentionally, no.
But by following the standard of care, not knowing how to support and help rebuild the body at all.
Yeah, and what's ironic is if this doctor had not followed the standard of care and given her antibiotics and an inhaler, and the child still had died without those things, then he or she would have been held responsible for medical malpractice. I mean, that's how crazy this is.
It is, and I can see the doctor's point of view, and they're not trained as healers. So that's what we're here for. We're here to try and teach you this forbidden information. Now, we're not saying if your child can't breathe to not run them to the hospital.
Oh, no, that's the first place you go.
This is life-saving and stuff. But what didn't happen was nobody taught this mother or parents how to stop it from happening again. They didn't teach them how to heal, how to feed the body enough, fat and protein and warmth and calmness.
Some good herbal teas in the midst of a breathing crisis.
Yeah, just calm down, and when you bring them home, maybe a few times, those inhalers can be life-saving in a crisis situation, but they do stop all healing. And if you use them over and over and over again, that's what happens. Eventually, all the bronchi collapse all at once, and there's nothing you can do. That's why 1 in 7 that enter the hospital in an asthmatic crisis dies. Modern medicine can't stop that.
No. And all we can say is they just didn't know.
The parents just didn't know.
No.
We don't have healers anymore. We are in the dark ages of healing.
Well,
Okay? Not
we
crisis
certainly
care.
are. We certainly are.
Okay. We used to have a weekly feature when we had our video cast where we would explain silly and even dangerous information we're told from the medical, pharmaceutical, industrial complex. And it was called, These Are the Secret Things They Keep From You, the Dumb Things They Tell You, and the Really Important Things They Know Nothing About. So can you imagine how important this was to that mother?
Yeah.
And father? I'm sure she had a father too. Can you imagine how important they know nothing about? Nobody knows about the warm blanket anymore, and that this was a benign but a benign condition 70 years ago, and now it's killing, and it killed right in our neighborhood.
Well, we want to talk about why that's the case.
Yeah.
So just by way of definition, I think most of you are familiar with what asthma is. It's this long-term inflammatory disease of the airways inside the lungs. And, and there's the, bronchospasms and airflow obstruction. I mean, that's pretty well how it's diagnosed. And you get this wheezing and coughing and chest tightness and shortness of breath. And these episodes may occur a few times a day or a few times per week.
Yeah, and depending on the person, they may become worse at night or with exercise.
Yeah, and asthma is thought to be caused by a combination of genetic and environmental factors. I'm going to address the genetic ones here in just a moment. The environmental factors, of course, all the tremendous air pollution that's out there now, all the tremendous amount of chemical allergens, especially in our modern high-tech houses. And then there's other potential triggers. Medications can cause it. Aspirin can cause it. Beta blockers, they say, can cause it. And there's also an association between acetaminophen use. People who've used acetaminophen, Tylenol over a period of time develop asthma.
Yeah.
And what about vaccinations?
Yeah.
I mean, that wasn't discussed at all.
Yeah. So the use of antibiotics, they just hand them out like candy anymore. And you got to wonder, what did the antibiotic do to this little girl? They bring her in, they start her on antibiotic, they do the nebulizer. She's dead 2 hours later. So...
Yeah, and you can only believe that regardless of how serious her condition was, if she hadn't been given the antibiotics, if she hadn't been given the nebulizer, she might still be alive.
She might be. So use of antibiotics in early life, it has been linked to the development of asthma. Also, delivery C-section is associated with an increased risk, estimated 20 to 80%.
Of asthmatics.
And you understand why.
Were born C-section, yeah.
They did not get the microbiome from their mother going through the birth canal.
Right. And so that lack of healthy bacterial colonization decreased their own immune strength and resilience even from birth.
Yeah. So that's where the toxic gut comes in, and your lungs are sometimes called the second colon. I mean, excrete so many gases and so many things, and they just get overwhelmed. And the body has a beautiful inflammation system to go in and fix this. But if you go to Wikipedia and you look at prevention for asthma, it says the evidence for the effectiveness of measures to prevent the development of asthma is weak. Yeah. Now, see, this is what we talked about in our last podcast. They forget and they remember. They forget the way we healed and then they remember.
Well, the thing with asthma is so critical. In most cases, all they know about is how to handle an acute case of asthmatic attack.
That's the crisis
They don't
care.
look at what's led up to it. They don't really
know how
examine
to heal it.
Precisely.
Yeah. So they say weird things like, well, I mean, some of this is good. It says you should have early pet exposure. That may be useful. And that's good. Why? Because you get the microbiome. You get all the bugs and the parasites and the protozoa and the fungus.
Yeah, well, we've often said, let the dog lick your kid's face.
So that keeps your gut healthy so it doesn't have to expel those toxins into the lungs.
Yep.
They also said, dietary restrictions. Oh, this killed me. This killed me because we get our healthy gut or not healthy gut from our mothers during birth. Mm-hmm. I mean, our intestines are completely sterile as far as we know. And that first going through the birth canal, you swallow and get in your eyes and your ears, that beautiful flora, all those bugs from your mother. And then the first nursing, it just goes in and embeds in the wall of your intestines. And it just sets up housekeeping. It's the most beautiful thing. But this Wikipedia asthma recommendation, it says dietary restrictions during pregnancy or when breastfeeding have not been found to be effective with asthma and thus are not recommended.
Yeah.
Can you, the medicine's recommended, but not to get the mother healthy.
Yeah,
reduce.
Yeah, right.
Yeah.
Not to stay away from allergens.
Well, it kind of says don't smoke,
Oh, well,
yeah.
Exercise, lose weight.
Yeah, and it says,
all the cure-alls.
It says it's not clear if annual influenza vaccination affects the risk of exacerbations. Wow. But it says immunization, however, is recommended by the World Health Organization, and smoking bans are effective in decreasing exacerbations of asthma. That's the whole thing on prevention.
That's it, yeah.
That's the whole thing on prevention.
What about those who don't smoke and still are having asthmatic
attacks? This little 4-year-old girl didn't smoke.
Didn't she smoke? I don't think so.
I can't laugh.
Didn't look like it.
I take that back.
It's
so sad. It's so sad. It's a bad gut is what it is. And that's what... And
that's what showed in her face when we saw the picture.
Yeah. And then it says, while there is no cure for asthma, symptoms can typically be improved. Now, this is deadly, and they're just treating it. It's called management in this article.
Yeah.
This is how you manage asthma. You can't cure it. And so
You manage it.
It says the plan should include reduction of exposure to allergens. Okay, how about reduction to the allergens in your gut? How about getting the gut? Of course, they don't mention that at all. The treatment plan should be written down, and it says the most effective treatment for asthma is identifying triggers such as cigarette smoke, pets, or aspirin, and eliminating exposure to them. I don't know. If trigger avoidance is insufficient, the use of medication is recommended. Pharmaceutical drugs are selected based on, among other things, the severity of illness. Oh, she had it pretty bad, didn't she? She's dead 2 hours later.
Breathe.
And the frequency of symptoms. Specific medication for asthma are broadly classified into fast-acting and long-acting categories, and it goes on to these different types of stabilizers and corticosteroids. And it says, for those who have daily attacks, a higher dose of inhaled corticosteroids, the inhalers. Okay, for those who have daily attacks, a higher dose of inhalers is used. In a moderate or severe exacerbation, those inhalers or those nebulizers and medication by mouth are added to the treatments. So, that's it. That's the whole management. It just says manage the level of anxiety in people with asthma, and that's it. There's nothing else. There is nothing in here about how to heal the lungs or heal the gut and avoid this horrible, sad death.
Yeah. So what do? Well, you modify your lifestyle according to the medical point of view. It's just stop it.
Did they tell him not to eat Cheerios for breakfast?
I don't know. So the avoidance of triggers, as you've been reading here, is a key component of trying to improve control and preventing the attacks.
Yeah, nothing about building the immune system or healing the gut. Just watch out for the next exposure.
Oh, that's right. Watch out for those cigarette smokers.
Those
watch out for that secondhand smoke.
Vacuuming.
Yeah.
Yeah.
And you know, there are laws that limit smoking. Actually, where it's enforced, decreases the number of people hospitalized for asthma. So we know that has something to do with it.
But here's what they say. Yoga could provide small improvements in quality of life and symptoms in people with asthma.
Do you remember what asthma?
Yoga.
Do you remember what asthma had to do with the beginning of my practice in 1995 in Salt Lake?
Oh, that's how you started your practice.
Yeah, I went to this lady who was the manager of the radio station.
It's a good story.
Yeah, and I had just arrived from Tulsa with a family, and I called her up because I used to listen to that. It was K-Talk, AM 630. Used to listen to that radio station long time ago. Bob Salter and the crowd. And I called her up and I said, hey, I need some time on the radio, but I don't have any money because it was like $350 an hour. And so I said, if you'll let me have an hour on the radio show, I'll cure your asthma.
You said that?
Yeah.
There's no cure for asthma, Jack.
I know.
Don't you know?
Well, I hadn't
read Wikipedia.
I hadn't read Wikipedia yet.
Jeez.
And what did I have to lose? If I didn't help
your
her,
reputation.
I'm not out any money. Nobody knew me.
I guess so.
So I worked on her.
They get to know
I worked on her on Monday. She had me on the radio show with her Thursday. And as I walk in the radio station, she's waving me into the broadcast room, and I go in, and she says, ladies and gentlemen, John the Baptist has arrived in Salt Lake City. And I'll tell you all about it during the next hour. So what am I going to say? So anyway, over the next hour, I could explain what I did as far as Atlas control and its effect upon asthma in reducing asthmatic symptoms for a very good neurological reason that I'm not going to go into in this podcast. But we've had great results with breathing problems with a lot of people. Anyway, she had me back for 2 or 3 or 4 more months. And then I had a chance to be on Saturdays. And then a little while later, I took over the morning drive time Monday through Friday for 20 years.
But what she said was she got up that morning and she could smell.
Even before I knew whether she had any results with what I did, she said, I walked out and could smell the western desert air for the first time in 33 years or something like that.
It was beautiful.
Yeah. And I just...
it's a good thing, man. And that's a structural... incredible
there's
healing.
a structural component to asthma,
but
yes.
if she had the nutritional support that I think she needed, she might live a little bit longer. She did die pretty.
So diagnosis, to diagnose asthma, there's a pattern of symptoms, and they use something called spirometry, which is measuring your ability to breathe. And as you pointed out, Mary, a few minutes ago, medicine's opinion is that there is no cure for asthma. The only recommendation for symptom relief is just that, symptom relief. And
that's not enough for a mother.
Yeah, and the medical doctor's recommendations, as you were reading through there, avoid triggers, avoid the allergens, avoid the irritants, and breathe in corticosteroids.
Unbelievable.
And the list of terrible side effects involved with corticosteroids.
Oh, they're so scary.
Well,
you can Google them, but hey, the number one risk is death.
Yes.
Yeah. Or stopping breathing. There's that. And the biggest risk, in my opinion, is that it greatly inhibits healing and the inflammation that is bringing those healing fats and the healing food from the blood to heal.
The medical approach to manage the symptoms of asthma prevent the body from healing the asthma.
Isn't that crazy? Yeah. Say that again.
The medical approach, the standard of care for dealing with asthma, involves a chemical intervention that prevents the body from healing the asthma.
Can we just have a moment of silence? I mean...
And there's
it's like depression drugs, the side effects are suicide,
Well, where did these things come from? Well, oral corticosteroids began to be used for asthma in about the 1950s when they invented them. Mm-hmm. And then the inhaled with the little inhaler started showing up in the 1960s. Now, as you go back and read in medical anthologies during the 30s to the 50s of last century, asthma was known as one of the holy 7 psychosomatic illnesses. And its cause was considered to be psychological. Yeah, with
You're crazy.
treatment often based on psychoanalysis and other talking cures.
Well, because they did panic. I mean, when you can't breathe, you have a
So the
panic
psychologist is sitting there talking to an asthmatic victim, and when did you start hating your mother? So as these psychoanalysts interpreted the asthmatic wheeze, they said it was the suppressed cry of the child for its mother.
Oh, my goodness.
And they considered the treatment of depression to be equally important for individuals with asthma.
Wow.
Now,
I would be depressed if I continually couldn't breathe.
You bring it up
and I never got better.
You bring it up till now. We've come up now from the 1950s to 2015. According to WHO, the 358 million people globally had asthma, which was up from 183 million just 25 years earlier.
So from 1990 to 2015, 183 more million people got asthma.
Yeah, and 397,000 deaths in 2015 alone.
From asthma. 397
and most of which
deaths.
Occurred in the developing world. And it often begins in childhood. And the rates of asthma have increased significantly since the 1960s. So how does genetics figure into this? The medicine is saying one of the causative factors is the allergens that cause the reaction, but also genetics probably plays into it. But if there are so many more people now than there was just 70 years ago having asthma, usually it takes a generation to a generation to a generation to a generation.
Well, asthma was recognized as early as ancient Egypt.
Oh, yeah.
So this has been around a long time.
It comes from the Greek word asthma, which means panting.
Is that how they pronounce it?
Yeah, and
asthma?
so like asthma. And so, yes.
You
didn't know I was a Greek
scholar,
did you? And so, like millions of others, many have succumbed to their fate and never went anywhere anytime without their most hated companion, their pocket albuterol inhaler, and at times even a Dulera inhaler, which is an inhaled, it's a very powerful inhaled steroid. So, not all viral and bacterial infections completely leave the body, especially when you've been using antibiotics, because the more serious symptoms, when they disappear, there's still bacterial infections on a subclinical level, and they're hiding in your lymph glands, these bugs, these microbes, which are, of course, closely related to the lungs, and therefore you have chronic asthma and chronic bronchitis. But, we always have good and bad bugs in us, but we have to build the immune system by eating good foods and keeping our gut healthy and supplementing things that strengthen the immune system, especially when you're suffering from a chronic problem.
Yeah, dense food.
I was talking to a patient recently about how their asthma had been nearly killing them.
Wow.
And they couldn't understand why they felt so bad. We were just starting care because, as they told me, they were on a very healthy vegan diet.
Oh, dear.
Oh, I was stunned. I had no idea.
Wow.
It was, and then...
And they're probably proud to tell you that, too.
Silence. There was silence. It's like the whole world went silent. You could hear a pin drop.
Oh, you went silent?
Oh, I'm sitting there going...
You didn't know what to say.
I didn't see that one coming. And without voicing any criticism, I just told her to listen to our podcast on the dangers of vegan and vegetarian diets, because a strictly vegan diet simply will not produce the level of good proteins that are required for the body to constantly maintain and rebuild the dense collagen-based tissues such as the bronchi and bronchioles are made of.
And even if this mother didn't feed her child Cheerios, she probably thinks, I've got to try to get them to eat their vegetables.
Yep.
So how do you build new bronchi or bronchioles? With vegetables.
Yeah.
You don't.
Or grapes.
And the kids don't even like them. And there's a reason why they don't like them. So these structures, the bronchioles, like bone, require much more dense protein development than anything. They require fat and protein, and they require the meat, eggs, fish, and dairy that has eaten the green plants, that can digest the green plants. So then we can eat the very easy to digest animal foods.
It's like the difference between
that nutrition.
The house of straw and the house of brick of the Three Little Pigs. The skin doesn't require a whole lot of dense protein, but bones and collagen and the strong, heavy, dense material that the bronchi are made from require very heavy protein intake.
Yeah. So asthma is always associated with being too alkaline, just as an overgrowth of bacteria in the body is associated with being too alkaline. We went over this with the flu podcast that we did in depth. And this is in reference to the blood pH balance.
Yeah.
And so eating what you crave, forgetting sugar and flour will direct your body back to a proper pH environment in the blood. You don't really get to adjust that. I mean, you can if you drink alkaline water.
Well, you can't adjust the pH of your blood.
No, not your blood.
Yeah.
Well, if you could, you'd be dead. So, but you don't want to drink alkaline water, especially in an asthmatic situation at all. So, because this can lead to an alkaline condition in the lungs where you will get a bacterial overgrowth. So, we have a couple paragraphs here from Dr. McBride, my hero. I fall asleep listening to her. And I did the other night. She was on my shoulder on my little iPhone, which probably isn't good, but I just listen and listen. She's just so brilliant. And she has, nobody can say it like Dr. McBride. And she talks about asthma. And I'm just going to read it because I can't paraphrase her. She says, whatever the liver doesn't clean up, the next detox pathway is the lungs.
Yes.
For instance, toxic gases escape this way. Toxins, undigested proteins, microbes, phagocytes, these ride up the
mucociliary
escalator. Isn't that cool? Didn't you learn about that in high school?
Yeah, when we were in health class and they're teaching us not to smoke, they show pictures of the little ciliary hairs that line the lungs, the bronchioles, the not the arterioles, but the bronchioles and the bronchi up through the trachea. And these things are constantly waving upwards, constantly
pushing
moving mucus, pushing stuff out of the lungs that don't belong there. That's what makes your sputum. That's what makes you cough.
Yeah.
And to get this stuff out of the body once the lungs get it up to that point.
I remember being taught this too in high school, but they told us one cigarette will destroy them and they never come back. These
well, they
scare
didn't tell
tactics.
Us that. They told us one cigarette will stunt them.
Yeah, mine was told there, never come back. And, that's scare tactics that don't work very well. But, of course, you can heal. But I'll go on with McBride. This escalator consists of every cell that lines our breathing pathways, which have stiff little hairs that produce mucus and point upwards. Toxins move up along the hairs and they get coughed up. When too much toxic material accumulates, enough to damage the bronchi, you will get chest inflammation or bronchitis, not due to a virus or a cold. See, so there's the antibiotic fallacy. Not due to a virus or a cold, although your sputum will show viral or bacterial presence. Actually, they were there before the attack.
Yep.
It is really just due to the level of toxicity in the bronchi that has built up a little too high and needs to detoxify. Asthma and, quote, chest infections are the lungs' way of trying to detoxify. Sometimes toxic gases end up escaping through the bronchi, gases that would normally be dealt with by the liver, but these can do very serious damage to the bronchi. What the body does to defend itself is to create a bronchospasm, a wheeze. During this time, for the 20 to 25 minutes that it takes for new cells to push the damaged ones out of the way and begin to do the important job of filtration, in other words, directing the traffic in the bronchi narrows to slow down the, quote, cars, so to speak.
In the analogy you gave.
In the analogy of cars running through a freeway that's all torn up. So do you get that? I mean, they're pushing everything out and then they narrow it down so they have time to get in there and heal. Okay, continuing on. If the cars and trucks are zooming by too quickly while the speedy road repair is taking place, there will be further damage to the cells. This temporary road closure allows healing to take place efficiently and in a relatively short time, 20 to 25 minutes. Once the passage clears and the new cells are working, the airway opens. Wow. Wheezing is a protective mechanism for healing bronchi, which illustrates exactly why asthma inhalers can be so damaging. By forcing the airway open at exactly the moment they need to be closed for cellular repair. Boy, could you say that better?
No, that's very concise.
All that people generally need is to sit up during a bronchospasm, keep warm, drink a hot tea, and let it pass. For a long time, that's all the advice doctors ever gave, and nobody ever died of asthma before 1950. Now that we have widespread use of antispasmodic drugs just since the 1950s and 60s, not allowing the bronchi to repair, we have airways getting further damaged with every bronchospasm. And with all this high-speed toxic traffic jetting by and not slowing down to give the airways a chance to heal for just 20 to 25 minutes, inhalers force passages open when they should be closed and healing. But the toxins keep coming from the bad gut.
Yep.
So asthma used to be a benign and mild healing event. Now it is one of the major childhood killers.
Yeah, the very thing that medicine does to address the crisis situation prevents the body from healing the asthmatic reaction. What causes it? Tell about Amber calling you yesterday.
Ambrosia,
and being overjoyed about Roman passing his 3-year anniversary without going to the doctor for bronchitis, as he had done every fall since birth.
Yeah, this is my daughter. She was a nutritionist in our clinic. She occasionally consults with us. She's just amazing. Well, she's had a very sick child. Well, not very sick, but fairly sick child since
every
birth.
fall.
Yeah. Some other problems with the father and the mother-in-law and all kinds of different things that I won't get into here. But every fall, her little boy, our grandson, gets bronchitis. And a couple of times she has taken him in for what they call breathing treatments. Mm-hmm. And they're very scary, as any mother knows, when your child can't breathe. But she just does it once a year, or had done it once a year. But she called me all excited, and she said, "Mom, I got him through bronchitis again this year, this fall, without taking him to the doctor. This is the 3rd anniversary for this."
How'd she do it?
So I asked her. She said, "I had bone broth, just no food, just bone broth, not popsicles and
ice cream, all the sore throat stuff people do."
Yeah, when I was a little girl, I couldn't wait to get sick because I got 7-Up. And 7-Up, we never got 7-Up and ice cream and popsicles if we had a sore throat. The exact opposite of what should be done. But again, I was raised in a very medical family. So my daughter, she gave him bone broth, and she cooks up these garlics, this whole clove.
Yeah.
And she pours butter all over it and salt, and she says he just gobbles that up. That's a natural.
Garlic is a very powerful natural antibiotic.
Mm-hmm. Then she puts essential oils on his chest, and I asked her which ones they were, and she said she put peppermint straight on his chest, but she also puts doTERRA's Breathe Blend, which also has peppermint oil in it. Mm-hmm. And she used eucalyptus oil and Thieves or On Guard, depending on which company you buy it from. And now doTERRA now has a big breathe stick that you can rub on your child's chest like we used to do with Vapor Rub. Mm-hmm. So that was pretty cool. But here's the kicker. She gave him Conjuplex, which is it's in a powder. You can also get chewable Conjuplex for little kids. But when they're pretty sick and a sore throat, they don't like to chew or eat anything. So she opens up the capsules of Conjuplex, which is calcium, the most antiviral substance known to man, helps everything in your immune system. And it has RNA in it, and it has Cataplex ACP, vitamins A, vitamin C, vitamin P to rebuild, and probiotics. So she puts that in some milk or something, some raw milk, and he drinks that down. But here's what she says she was so thrilled about. I got him to down 4 doses of liquid Golden Seal.
Oh, no way. I think she's exaggerating.
You're such an actor.
I can only do 1.
Oh, that's horrible. Oh, Golden Seal is horrible. I don't know what she bribed him with, but she got him to. And she says as soon as he got those doses down, he perked right up.
That fast. Yep.
So that's wonderful. So there are natural ways of dealing with this.
Well, this is how medicine was carried out 100 years ago, before the discovery of antibiotics and steroids and vaccinations and everything else. Doctors, half of them were what were called bone setters because they knew the position of the bone in the spine affected health. And the other half of them were herbalists.
Well, speaking of those bone setters, we got a testimonial here from Nuka and Asthma. Nuka is the chiropractic form of
what we do in the clinic.
Yeah, it's what you do. And she said, my major health problem was asthma. My son had a problem with asthma his whole life. The last few months, it had gotten so bad that we were ready to go in and get an inhaler. So glad she didn't. He couldn't run without having tightness in his chest. We came in to see you. He was quite twisted. Dr. Jack, you even joked that he looked like he had played in the NFL. And he has had absolutely no asthma symptoms since our visit with you. Thank you. And her name. Yeah.
You bet.
Yeah. So isn't that wonderful?
Yes.
That just freeing up that nervous system from your brainstem can sometimes be all there is. Remember your son, Joseph? Dr. Joseph now?
Yeah, extremely serious allergic reactions.
Yeah.
And
allergies.
they stopped. Allergies. And they stopped right after his first correction.
Yeah. So
that's why I love taking care of younger people. Because I wish someone had done this for me when I was a child.
They don't know what they missed. Yeah.
Exactly.
But you guys, as mothers and fathers out there, if you can do a NUCA correction, we would highly recommend that. But at least get the gut healthy. So let's recap. Let's wrap this up. I think we've scared them sufficiently. And
well, number one, asthma's been around since the beginning of time in a much more reduced serious condition compared to today.
It was benign,
Yes.
and nobody died of it.
And it's only become the very serious condition it is in some children and some adults over the last 70 years following the introduction of both oral and inhaled corticosteroids.
Yeah. You think serious? Death? Death right in our neighborhood. The tried and true method of dealing with an asthmatic reaction was to wrap the person, especially a child, in a warm blanket, give them some mild tea, bone broth, or herbal drink, keep them as calm as best you can because they're not crazy, they're panicking, they can't breathe, and realize the body is not stupid. It is taking care of its own crisis, and even though the child is wheezing, they are getting air, and the healing crisis will be over in a few minutes.
If they weren't getting air, they wouldn't be wheezing.
Yeah, isn't that beautiful?
Yeah.
Wheezing's good, but that's why you need to keep them calm because they do feel like they're not
scared.
Yeah.
And so some of the triggers for asthma stem from the gut and the body as a whole. Because the body is no more healthy than the gut's healthy.
That's right.
And so
that's the soil.
Yeah, the soil.
Yes, that's
and
the
the
soil of
GAPS
your body.
program should be employed in any child that has a chronic condition such as asthma. We have more on GAPS in many podcasts, but to introduce the concept, we recommend listening to podcasts 4, 42, and 43. Because GAPS has not only helped with asthma in children, but many other conditions, autism, psoriasis, psychological issues, and, of course, serious digestive and elimination problems.
So go to our website, forbiddendoctor.com, and search for asthma or bronchitis. We've got beautiful protocols on there, and we've got an asthma protocol for children and just an asthma general protocol, I guess, for adults, and then a bronchitis one. And they're beautiful protocols, and these are for... Some of it is for crisis care, especially for the bronchitis. We've got my daughter's essential oils in there, and we have all the crisis care type supplementation. We're not saying not to go to the hospital or not to even get an inhaler or a breathing treatment, but just don't have it be constant. You need to heal the reason for the asthma, and you need to heal the reason for the bronchitis.
Once you're home from your little ER visit,
Yep.
and we highly recommend if you're having breathing difficulties, get to the ER ASAP. But once you're back home, start looking at why this happened and start doing something about healing the gut and strengthening the immune system because 80% of it's there in the gut anyway.
And it's very real. This is forbidden information. It's kind of scary to get it out there, but this is what we've done for many, many years. And keep your children off of candy and give them what they will eat of meat, eggs, fish, dairy, and spices, and as raw as you can get it.
Yeah. And even if you've done it before, don't forget to do our free symptom survey that we offer at forbiddendoctor.com. If you're having a problem with the very thing we've been talking about in this podcast, at the bottom of the survey, write in history of asthma, history of bronchitis, history of breathing problems, whatever. And we can give you a protocol that we've listed above in the Forbidden Doctor website.
Or we can personalize it.
Yeah.
Yeah.
Well, that's the whole idea of the symptom survey is to make sure we personalize it for you. And many of you may be finding us for the first time. So keep in mind the protocols on our website and what we've been talking about are only available to logged in users. But you can create an account instantly by taking our free, no obligation symptom survey.
Yeah, and you'll also have the opportunity to have a free 30-minute phone consultation.
Yeah, and understand that the survey saves you money in the long run by the fact that you're only going to be taking supplements you need, and you don't have to take that whole plethora of supplements you don't need. And at this point, all of it is at no charge to you.
Yeah. And if you do decide to purchase the recommended supplements, you can get them at a 10% discount if you sign up for a text blast. These text blasts give you fantastic coupons every single week. I should say the first time you signed up, you get a 10% discount. Not continually, but the first time. But every single week we have coupons.
Yep.
So just text the word healthy to 41411, and we'll text you back a coupon code, which you can use on our website, forbiddendoctor.com, when you check out.
Or you can always call our office at 801-523-1890, and they can help you sign up for the text blasts and answer any questions about the supplementation that we're recommending and the Forbidden Doctor's mission.
So we are revealing health secrets they don't want you to know. And remember, your patronage of our offers keeps this podcast on the air.
So who's going to read the disclaimer this time?
I will.
All right.
The statements made in this podcast and about... Nope, see, I messed up already. The statements made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only and is not intended as a substitute for advice from your physician or other healthcare professional.
Sold me.
So thank you for listening to this Forbidden Information and our Forbidden podcast.
Yeah, join us next time for another in-depth discussion of forbidden knowledge.
We'll see you then.
See you then.
Thank you for listening to the Forbidden Doctor podcast. If you are curious about long-life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com or get our enzyme formula from Amazon.com by searching the full term, Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.